Hi everyone, this is Tracy Koch again, and we're going to pick up from where we left off on the previous presentation for Chapter 8. The production of different types of procollagen and its modification steps are genetically controlled. In other words, our genes control how collagen is made. Mutations that affect the production and composition of any collagen type or interfere with its modification, assembly, or association with other molecules will result in a collagen disorder. Collagen types, there are 5 main types and many minor types or many types that aren't considered major types, if you want to look at it that way. Type 1 is our most common. The major component is, so type 1 is our major type, located in bones, the skin, tendons, ligaments, and corneals, intervertebral discs, and blood vessels. Type 2 is what we find in cartilage. Type 3 is in skin, lungs, intestine walls, and blood vessels. Type 4 is in the kidney and the inner ear, which is no surprise because you'll remember embryonically, kidney and the inner ear arise from the same tissue formation. Type 5 is found in skin, ligaments, bones, tendons, muscles, and the extracellular matrix. Collagen fibrillin disorders that we're going to talk about in this chapter are osteogenesis imperfecta, Ehlers-Danlos syndrome, and Marfan syndrome. Osteogenesis imperfecta, or OI as it's known, it's a group of genetic disorders in which the formation of collagen is impaired. This results in easily fracturing bones. It also might have some other mutations in different genes for type 1, which can result in a variation of the disease severity. This is an autosomal dominant transmission. Autosomal dominant. The incidence is type 1, which is our most common, is 1 in about 15,000 to 30,000 live births. The pathophysiology of osteogenesis imperfecta, or OI, is the failure to produce at least one functional chain of procollagen. So as we talked about earlier, procollagen is what we need in order to make collagen, which causes the developing bones to have less structural integrity, therefore less strength, and therefore increasing risk of fracture. The severity of this is related to both the degree of normal collagen reduction present in the bone and whether or not abnormal collagen is produced. So it's not just the lack of collagen, but whether there is abnormal collagen as well. There are 4 main types of this disorder. The first type is type 1, where you have reduced amounts of normal collagen. So production of normal collagen is reduced. Fractures occur in response to minor trauma throughout the lifespan. And a little tidbit is the blue-tinged coloration of the sclera on folks with this disorder. Type 2, you have no normal collagen produced. So this is the most severe type of OI. Bone fractures and skeletal malformations occur in the prenatal period, and they are lethal. Type 3, collagen is produced, but it is abnormal. So there's fracture and some skeletal deformities present at birth. Fractures continue throughout the lifespan. Children affected with OI type 3 are short in stature. They have muscle weakness, hearing loss, joint laxity, blue sclera, brittle teeth, restrictive pulmonary disease, and a reduced lifespan. Type 4, abnormal collagen is produced, but it functions better than in the other OI types. You have a normal sclera and fewer fractures and less deformities. So those are the 4 types of osteogenesis imperfecta. Management of this disorder is really just that. Fracture prevention, physical therapy and swimming, fracture management when they do have fractures, braces to support legs, ankles, knees, and wrists, surgical implantation of long bone rods, and the use of canes, walkers, wheelchairs, etc. to reduce injury on weight-bearing bones. Ehlers-Danlos syndrome is the second type of disorder we're going to talk about. It's a group of 6 different inherited disorders that occur as a result of mutations in the genes responsible for collagen formation or modification. The disorders vary in severity in the tissues involved, and transmission pattern varies by type, but most of these are autosomal dominant. Incidence is 1 in 5,000 live births. The different types of Ehlers-Danlos, formerly type 1 or type 2, caused by genetic mutations for type 1 or type 5 collagen. So remember, it gets a little bit confusing. There's different types of Ehlers-Danlos, but the type 1 or type 2 was caused by a gene mutation for the type 1 or type 5 collagen production. And you'll remember the type 1 was your most common component of collagen for bones, dermis, tendon, and ligaments, and type 5 is connective tissue for skin, bones, and tendons, just to kind of reduce the confusion there. Another type is hypermobility, Ehlers-Danlos, and formerly that was known as type 3. There's no specific collagen mutation known, and it's an autosomal dominant pattern. Vascular Ehlers-Danlos is formerly type 4, caused by a gene mutation for type 3 collagen, and type 3 collagen is the skin and lung connective tissue. It is an autosomal dominant pattern. And kyphoscoliosis, Ehlers-Danlos, formerly type 6, and that is caused by a mutation in a gene responsible for modifying collagen. This is autosomal recessive. So those are the different types of Ehlers-Danlos, and those are described in your textbook. If this is confusing to you, I would recommend you kind of read through that so that you don't get confused on the types versus the types of collagen production that's affected. Ehlers-Danlos syndrome, the signs and symptoms, in the classic case, or the classic type rather, skin and joints are hyperextendable and stretchy. The skin is very fragile. These patients have chronic joint pain, and it's one of the most, or it is the most mild disease type of this collagen disorder. Hypermobility Ehlers-Danlos is hypermobile joints with subluxation and dislocation. Chronic joint pain, extensible skin, but it's not as fragile as the classical. Vascular Ehlers-Danlos is thin, fragile skin, short stature, small face, thin walls of arteries and intestines. So remember that this affects the connective tissues. Severe disease has an early death. Kyphoscoliosis, Ehlers-Danlos, is laxity of all joints. It's present at birth. Its progressive spinal curvature and muscle weakness lead to a severe disease with an early death. There's no cure for this syndrome. Management strategies will vary by the type of disorder, but you focus on protecting the joints, delaying complications, avoiding trauma. Use of physical therapy is helpful with these patients. Marfan syndrome, you all have probably at least heard this term, if not become somewhat familiar with it, but Marfan's is an inherited connective tissue disorder. It's not really a collagen disease, it's a connective tissue disorder. The mutated gene, there is a mutated gene, and it's responsible for fibrillin formation, so that process is interrupted. So the gene for fibrillin is mutated, preventing fibrillin from interacting with collagen and elastin to provide recoil strength to tissues during and after stretching. This is also an autosomal dominant transmission with a relatively high spontaneous mutation rate. The incidence is 1 in 5,000 live births. Marfan syndrome, there's too little fibrillin present to limit the stretch of tissues and allow muscles and tissues to go back to their original resting shape. So the dynamic strength of your connective tissue is greatly reduced. The major gene affected is FBN1, which is large and expressed in many tissues. Therefore, you'll see symptoms of many different kinds in Marfan syndrome because so many different tissues are affected. The connective tissue is unstable, it's weak, and becomes overstretched, and with time it remains overstretched. The effect of the mutation are widespread and vary. So Just because two people have been diagnosed with Marfan's, they may have widely different experiences with the disorder. The signs and symptoms, manifestations vary somewhat, just as I mentioned, even within a family. The affected individual usually has many signs and symptoms, but rarely have all possible manifestations. Most commonly, the symptoms are of skeletal, ocular, and cardiovascular systems. The cardiovascular problems are what we hear about most often and are the most common cause of premature death. Signs and symptoms, and these are also nicely listed out in your textbook. They're usually a tall, lanky stature, arm spread width is greater than the height, loose, lax joints, long, hyperextensible fingers, spinal curvatures, chest deformities, narrow arched palate, crowded teeth, smaller regressed chin. Those are some of the characteristics. Here are some more: downward slanting palpable fissures, flat cornea, displaced or detached lens, myopia, small iris, mitral valve prolapse, widened aorta, aortic aneurysm, left ventricular enlargement, and cardiomyopathy. The management of Marfan's is really to monitor and protect the cardiovascular system. These patients have yearly evaluations, minimum yearly evaluations of left ventricular function, their ejection fraction, mitral valve function, and aortic width. Maintaining a normal blood pressure is critical for these folks. Also determining the need for any surgical interventions if we have any heart valve issues or the widening aorta, they may need surgery to correct that. Management of Marfan's syndrome is maintaining a healthy weight, avoiding strenuous exercise. So low intensity regular exercise is definitely recommended, but strenuous heavy lifting, contact sports, anything that really stresses that cardiovascular system is not recommended. Low intensity stuff, golfing, swimming, low intensity bicycling, walking, those are all highly recommended, but really just watching any kind of strenuous activity. So this is the end of the slideshow. I apologize for the interruption in the previous one, and I certainly hope this is helpful for you. Thanks.